Hi, I'm 85 years young,
Nice.
and I saw a Tibetan monk who's 118 years old doing Qigong, and that's what I'm going to do at 118. My wife and I get up at 4 o'clock and do the meditations. We're serious.
Hey, how can you not love this guy? And I've seen you a lot lately, haven't I?
I don't know. Yeah, we've been around. 3 advanced workshops.
3 advanced workshops.
Okay.
How would you like to have a grandpa like him?
I'm asking this question because others might be helped. I got a voodoo curse in February when I had an MRI, and I didn't have any pain, but I had an MRI because of, well, a long story. And the MRI showed that my spinal column was challenged. T5, T4, and S1. And it
L5,
was,
L4, and S1.
Yeah, whatever. And I had no pain. So the doctor said, here's some pain pills, come back in a month, and we might look at, see if we need surgery. You don't need it now. And I said, thank you. Oh, and I said, by the way, I'm going to meditate this out of my system.
Oh, he probably, or she probably loved that one.
And he said, I've seen a lot in this world, but I ain't seen anything like that. And I says, okay, thanks.
So you didn't take the voodoo curse.
Okay. So the question I have is, I know through the meditations I'm getting healed somehow. And I really don't know whether I should get another MRI and when. But
Okay.
I don't have any symptoms, so do I just forget about the MRI and say this to the doctor or what?
Excellent question. I love him. Now, let's build a model here. I have nothing against medicine. I love medicine. And it works really well for acute conditions. If you have appendicitis, you break your arm, it's a good idea to go to emergency care or see a physician and not go to an acupuncturist. It's just not the best choice to make, right? Because that is the protocol you need for that condition. When we talk about chronic conditions, though, chronic long-standing conditions require a lifestyle change. And a lifestyle change means you got to change behaviors and make different choices. And you have to learn how to adapt to your environment without having any stress or reducing the amount of stress that you have in your body. And you can talk to people who treat chronic conditions. I had a huge clinic in the Pacific Northwest where we treated a lot of people in 1 week. And we treated chronic conditions because nobody wanted to do it. And we took it on, and we had referrals from all kinds of different physicians in the area. And we helped people a lot. But when you deal with chronic conditions, if a person doesn't really understand how to manage their emotions, you will see them back in your clinic 6 months later to a year later with the exact same condition. And they'll ask you, how did it come back? And the answer is you're just perceiving your environment the same way. And you're reacting to the same people in the same conditions in the same way and producing the same emotions. And it's those emotions then that keep your body in the past. How many people understand? And yet, you know, if you look at the Medicare guidelines in the United States, arthritis needs an incident, which means if you flagged 20 people down on the street and you took x-rays and MRIs of their spine, you would see about a little more than 50% of those people with some type of degenerative changes, just wear and tear. But out of those 10 or 12 people, only half of them would have symptoms. The other half would have no symptoms at all. In fact, if you did the MRI, some of them would show a bulged disc and have no pain. So the objective measurement has to be correlated with the subjective finding. Are you with me still? So the answer to the question is simple. Keep doing the work. If you have no symptoms, there's no need to address it. Sure, there's some degeneration. And doing everything that you're doing, as a man that's over 80 years old with that kind of amazing mind and that kind of amazing body and that kind of energy, if I was attending that case, I would just say, keep doing exactly what you're doing. Surgery is not indicated in that condition because there's no severe pain that's interfering with that person's life, and there's no objective orthopedic findings that would be significant enough for that person to make that choice. Does that make sense? And you start doing a little bit more yoga, you start stretching a little bit more. The spine is really poorly vascularized. It doesn't have a good blood supply. It gets blood through osmosis, through changes in concentrations of fluid. So the spine tends to dry out as we age because we become less active. And so the wear and tear begins to cause some degeneration. So as you begin to do motions where you're stretching connective tissue and you're stretching the tissue, you're getting oxygen and nutrients into the joints. And if you get oxygen and nutrients into the joints, you get waste products out the other side. And those discs can actually puff up. They can get fresh blood in there, and you can start to notice a significant change. Now, there is a future you that already exists that has no symptoms and a change in your arthritic condition. And all you have to do is become that person. And I pretty much have no doubt that you will.